Greetings, my name is Cassandra Shaw, and I am a certified health education specialist with No Struggle, No Success Reentry Program. In this presentation, we will be going over health literacy. We will do an overview about the basic understanding of health literacy, challenges with health literacy, and ways to increase health literacy. But first, you may be wondering, what is health literacy? Health literacy is defined by the Office of Disease Prevention and Health Promotion, Healthy People 2030 Initiative, as the degree to which an individual has the ability to find, understand, and use information and services to make informed health-related decisions and actions for themselves and others. Health literacy is a critical focus of the Healthy People 2030 Initiative, which encourages efforts to address skills that people move from understanding to action and from a focus on their own health to a focus on the health of their communities. A person's level of health literacy really influences their health-related behaviors, along with their ability to navigate health systems. There are challenges in health literacy. The average reading level of Americans is 7th grade. Yet healthcare information is communicated at a college level. There is a disconnect here. This disconnect leads to confusion, frustration, and helplessness. When patients are left confused and frustrated after a doctor's visit, patients aren't receiving quality care. This is a disconnect with healthcare professionals and patients, and a patient needs to understand everything that's going on and feel comfortable with their health professional so they can get the care that they need. For instance, like this image here, prescriptions. A prescription can say, take 2 pills 4 times a day, but it doesn't give this clear description like on the right where it says take every day, 2 pills in the morning, 2 at noon, 2 in the evening, and 2 at bedtime. Even though that makes sense, right? You may receive the written information, but it is in this big stack of papers that are overwhelming, using all of these words that you have never seen before. And most people, they don't even read it. They don't even attempt to read it, and they don't even understand their prescriptions, how they should take them, when they should take them, and what they are actually doing for their body. This shows the clear disconnect. And this shows that health literacy is a two-way street between the doctor and patient. Doctors need to understand patients, and patients need to understand doctors so that patients receive quality care and that doctors and health professionals are able to provide patients with exactly what they need. There are some risk factors associated with low health literacy. If English isn't your first language, everyday language can be difficult. Yet medical language and everyday language are different. Things don't always mean the same thing. For instance, hypertension is high blood pressure. They mean the same thing but can get lost in translation. Individuals with low income, older adults, people that may have experienced incarceration, and individuals under high stress. 9 out of 10 American adults struggle with health literacy at some point in their lives. And people with high literacy rates can have low health literacy rates in certain situations. Patients with low health literacy are more likely to visit an emergency room, mostly because they don't know that for some services they can go to their primary care physician. They don't always have to go to the emergency room in emergencies. If they can get an appointment, they can call in and make an appointment and see their primary care doctor. They also may have more hospital stays. Because chronic illnesses are managed at home, a lot of times people have struggle with managing their illnesses at home and end up being hospitalized. They are also less likely to follow treatment plans. Treatment plans are difficult to understand sometimes and can be very strict. And if a person doesn't know, that they have to do these things in order to stay healthy, they may not. And it also increases the cause of death for people. There are higher mortality rates for people with low health literacy. These things are very critical. Health literacy is super important. Knowing and understanding your health, your medical history, your medications, when and why you have received surgeries of any kind, all of these things are extremely important. And here are some best practices for health literacy. Choose doctors you feel comfortable with and can trust. Don't be afraid to ask your doctor to slow down, or to provide you with a visual aid, or to ask them to repeat themselves. Bring someone with you that you feel safe with. They can hear things that you may miss. Maybe a friend, a family member, spouse, anyone that you trust. Bring them with you to advocate for you, because you may miss things sometimes when information is overwhelming. And you can also request a printout of your visit and ask how you can follow up with any questions. The printout of your visit will include all the information that you covered. And if you have questions later, you can always ask then. Health education promotes health literacy and promotes making healthy decisions, increasing knowledge, and provides skill development to assess health information and resources. Your health educator, community worker, and peer advocates are available to support you with health literacy challenges and healthcare resources. These best practices are just first steps in helping you to increase your health literacy. But increasing and improving your health literacy is an empowering feeling. You will be able to communicate effectively with your healthcare professionals and also understand your healthcare management and your healthcare treatment plans. This is extremely important to have your overall wellness and to make sure that you are taking the best possible care of yourself and receiving the best possible care. Now that we have covered an overall overview of health literacy, what health literacy is, some challenges within health literacy, and ways to increase health literacy, consider the information that you just learned. Take a note of what stood out and what you think, and what you wonder about your own health literacy. Note down any questions that may come up for you, and keep those later for your next doctor's visit. In this note, also include things like any unexplained aches or pains anywhere, medication difficulties, if it's hard for you to take your medications, if they upset your stomach, or any changes in your body that you are confused or concerned about. And if you hear or read any information that you don't understand, ask for clarity and ask for a printout. But make sure you bring that note with you, because sometimes you may feel a pain, and when you get to the doctor's office, you completely forgot about that. You had headaches for like weeks straight, and they just came on and off, and you don't know where they came from. But you forgot, because when you got to the doctor, you were feeling fine. That is still something that you should talk to your doctor about. So it's good to keep a note of things when they come up, and you have it as a point of reference when you visit your doctor. Things to remember: health literacy challenges are common. 9 out of 10 American adults will struggle with health literacy at some point in their lives. Even people with high literacy rates can have low health literacy rates in certain situations. Low health literacy affects health outcomes. If a person doesn't understand their treatment plan, they will not adhere to it, and they will not get the quality care that they need. Effective communication is key. If you and your doctor have a good rapport and you trust them, you're able to tell them everything that's going on with you, and they can give you recommended advice with all of the information they need. You have the right to choose your healthcare professional. If you can't trust your doctor, you can always get another one. You can ask for additional resources, the printout from your visits. You can ask for a translator. You can ask for visual aids so that you are able to understand. And you have the right to receive quality healthcare services with your informed consent. That means you understand things that you are signing, you understand prescriptions you are taking, and you understand your overall treatment plan. It's been my pleasure to provide you with a brief overview of health literacy. Please take this time and the rest of this day to take gentle care of yourself. And again, my name is Cassandra Shaw. I am a certified health education specialist, and I offer health education sessions as a primary service with No Struggle, No Success participants. They are offered to educate people about behaviors that promote wellness. Positive health behaviors and health outcomes are an essential part of reacclimating mentally, physically, emotionally, and socially. My email address is included here, and adult and youth, both individual and group sessions, are available by appointment. I would be so happy to hear from you soon. You take gentle care and be well.